So I'm Alice Roberts. I'm from CPRE London, and I chair the London Boroughs Healthy Streets Scorecard Coalition. And this is, first of all, to welcome you to the launch of the 2023 Healthy Streets Scorecard. So welcome, everybody. Just a quick thanks to the Urban Design Group for hosting our launch event again this year on their Zoom account. Much appreciated. So the scorecard, for those who don't know, is the work of a coalition of organisations concerned with promoting active travel, but also including for the less able, but also for ending road casualties and creating a healthy and climate safe environment. There are various members of the coalition here today. So for brevity, please can you guys identify yourselves in the chat and say hello. Apart from the coalition, I just wanted to mention that we're supported by the Clean Cities campaign and Asthma and Lung UK, and we also work with London Travel Watch in support of bus priority. We came together 6 years ago, or around 6 years ago, when London's transport strategy was published with its 3 key targets, the targets being to reduce the trips made by car in favour of trips made by public transport, walking and cycling, to increase active travel and vision zero for zero road casualties. And collectively, we understood that that to deliver all of these targets, the same interventions were going to be needed. And we felt that that was a massive opportunity, basically, and we came together because we wanted to make crystal clear what were the fundamental changes needed, in our view, to deliver these targets. And I have to say that we didn't have a huge amount of difficulty agreeing on our priorities at the time, which were 20-mile-per-hour speed limits, controlled parking, safe protected cycle track, and low traffic neighbourhoods. Since then, we've added in school streets and bus priority. The other 2 reasons were that we wanted really unapologetically to show the differences between boroughs on where they were with these interventions. But we really also wanted to shine a light on positive action and to give boroughs support from civic society, if you like, to help to create a mandate for action. So I was slightly stunned to find us 5 years down the line. Actually, this is the 5th year we've published the scorecard. And so I thought that was a moment to reflect very briefly on what we've achieved over the past 5 years. And of course, while there's still a mountain to climb, our work has made it a huge amount clearer where we are now, I feel. And it's possible now for boroughs and officers and councillors to see really precisely where their borough is on a set of really important actions and interventions. And perhaps more importantly, on the action itself. And while, of course, it's boroughs who have to take the credit for delivering the massive expansion in measures like school streets and low traffic neighbourhoods, at least in some parts of London, then I feel that we can take some credit for this expansion, and certainly in supporting it and promoting it. So another thing that I think that I see today that we didn't see 5 years ago is that car ownership statistics are much more commonly used today in a way that they weren't 5 years ago, to demonstrate the large proportion of households that don't have access to a car, and to just make us think a bit differently about that. And perhaps, something that we can be most proud of is that while we didn't start with the idea of mapping, here we are now with maps of London's cycle infrastructure, its bus infrastructure, low traffic neighbourhoods, and new this year, a map of London's controlled parking zones. So I'm particularly proud of those, and really extremely grateful to the people who've put the effort in to create them, and the volunteers and our coalition partners who do all that work. So those are my reflections on the past 5 years. This year, we wanted to return to the issue at the heart of the scorecard, the health issue. So active lifestyles, as we know, are associated with lower risk of cardiovascular disease, coronary heart disease and stroke, reduced risk of diabetes, obesity, osteoporosis, and colon and breast cancer, and with improved mental health. And in older adults, it's associated with increased functional capabilities. So we're really super delighted to be joined today by Sandra Husbands, Director of Public Health for Hackney and the City of London, to talk about whether and how transport and health authorities might be able to work more closely together to deliver what we need to deliver in the next 5 to 10 years. And then we're going to move on to the results presented this year by Simon Monk from the London Cycling Campaign, one of the coalition partners. And we're going to hear briefly from a couple of this year's winners from Islington and Waltham Forest. And we're joined by Rowena Champion and Clyde Lake. So very happy to have them with us today. And then for the third, or I couldn't remember, Phil, if it was the fourth year, would be very happy to be joined by Phil Glanville, who is, of course, Mayor of Hackney, but also Chair of the London Council's Transport and Environment Committee, to reflect on the past year and look to the future. So there'll be time for questions at the end. Please put your questions in the chat, and then Jeremy Leach from London Living Streets, another coalition partner, will field the questions at the end. We will aim to finish by 11, but we do have till 11:15 if there are lots and lots of questions. So that's it from me. And without further ado, over to Sandra. Welcome.
Thank you very much, Alice. I'm really glad to be here, and grateful for the invitation to speak at this launch today, because I think the scorecard is great for both celebrating what's been achieved and also motivating boroughs to take action, or to take more action, on increasing healthy streets and active transport. So and it's a great way to monitor our progress. So I'm really pleased to be here, and you all know that about the scorecard. I won't go on about that. And as you've already heard, transport affects health in a number of ways, and it's not just through physical activity and air quality, but also the noise and stress associated with transport and travelling itself have significant impacts on both physical health and emotional health. And then, of course, there's the death and injury on the road from collisions, mainly involving motorised transport. So transport is a fundamental determinant of health. It's one of the underlying causes of ill health. Sometimes directly a cause of ill health, as in the collisions. And so really an important public health issue that many of us are engaged in doing something about. So I think this is a really timely topic. And as you'll know, the Mayor of London has ambitious targets to get more people walking and cycling, which are the main forms of exercise or physical activity in the UK. And it's often easier for people to incorporate that physical activity into their lives through things like commuting to school and work. So active travel is a great opportunity to get people to take some control over their health as well as over their mode of transport. And public health professionals and sustainable or active travel campaigners all want the same thing, really, which is we want more people walking, more people cycling, and more people using public transport, fewer motorised vehicles on the road. And I'm saying motorised deliberately, because I don't think that electric vehicles are the answer to this either. So I was asked a couple of philosophical questions, really. So rather unusually for a public health presentation, I'm not going to blind you with science or bore you with statistics, because the questions I was asked were, can we do more to join forces to deliver a better understanding of why we need change and more support for change, and ultimately better and more equal health outcomes? And is it time for public health professionals and transport campaigners to join forces? So this is an opinion piece, really, but I hope you find it useful. So the short answer to the question, sorry, there's a bit of background noise and it's rather distracting. The short answer to the question about whether we need to work together more is that public health professionals and transport specialists and campaigners have been working together for many years. In particular in Hackney, actually, which has led some pioneering work, as probably many of you know already, in London, such as being one of the earliest adopters of healthy streets and school streets, and doing an amazing amount to increase cycling. I remember being really inspired by a presentation by Lucy Saunders, some of you may remember years ago, when she was working in Hackney and I was working elsewhere, and thinking, yes, this is what we need to do everywhere. And she was a public health professional working with her transport colleagues in Hackney. So if we're already in so much agreement about what we want, and there's people already working together, what needs to change? So in my opinion, there's often a bit of a tension between the public health and professionals and transport campaigners. I think it's a healthy tension, and I'd like to think of us as critical friends. We both work in evidence-based ways, and we're both concerned about populations. We're both, as in both groups, interested in changing policy and also changing individual people's behaviour. But transport campaigners tend to be divided by or focused on particular modalities or outcomes such as cycling and clean air, while public health professionals are trying to overall, generally, improve the conditions and opportunities to improve health. And that's thinking about all the different determinants and their interactions, and for the whole population, but also particularly for particular groups or communities as well. So to summarize it, in public health, we tend to be much more mindful of inequalities or inequities and the unintended consequences of some really well-intentioned transport schemes, and not just the outcome of the transport scheme in terms of maybe reducing traffic or improving air quality on a particular road or set of roads. And I think that this is a really important point of tension, and I'll give you an example to explain it, but I'll also just quickly explain what I mean about the difference between inequalities and inequities. Inequalities are things that you can measure, where you can measure a difference between two things and they're not equal, they're not the same. But the inequity tells you that there's something about an unfairness or an injustice that is driving that inequality. So the inequality helps us understand where things are not the same, but the root of it and also the impact of it tells us where there's that inequity, and that's one of our concerns. These inequities tend to congregate. So the poorest people, the people with the least education, the people with the worst access to other things, are also the people who are most likely to live on a busy road, and therefore have the most impact from the noise, the risk of accidents, the pollution, but they're also least likely to own a car and be contributing to that. So when we, as an example, put in a low traffic neighbourhood, the question we need to ask ourselves is not, did it reduce traffic in that neighbourhood and reduce the air pollution in that neighbourhood, which is, obviously we need to measure the impact and evaluate it, but it's kind of a given. But what's the impact on the neighbouring neighbourhoods, or particularly on the main roads where you might expect traffic to divert to, and that might be perfectly reasonable practical outcome from saying, well, we'll reduce traffic here because it's very residential and we'll divert it to the main road, but people also live there and go to school there and work there. So how do we understand what those impacts are, and how do we work out together how to mitigate them? And that's where I think that there's a bit of a gap and an opportunity for us to do things together better. So to my mind, there are a few ways in which we could work together a bit better, that are both about understanding each other's perspectives, but also just about jointly doing things. Also, one of the ways is that we could work together better to address the inequalities that already exist in health and in access to clean and active transport, as well as those that might arise completely unintendedly, I'm sure, or be increased by traffic schemes that are implemented. And in order to be able to do that I think that we could work on developing a joint evidence base, because quite often these things are done very separately. So you have transport campaigners and activists looking at certain elements of it, and public health people looking at certain elements, and actually we could just be bringing that together, both in terms of the practitioners, but also the academics who look at these things, saying, let's have this very rounded, multi-professional look at what works best in terms of policy and individual behaviours, but also what are all of the potentially unintended consequences? Who are the marginalised groups who are disadvantaged now, who may be more disadvantaged? How do we increase equity for them? So I think that joint evidence base would be a really good opportunity to work together. And another one is in terms of our approach to planning and implementing new transport schemes. It kind of falls out of the first one in a way. So it's that public health approach, which I'm sure you've all heard bandied about. But by that, I mean that the approach is informed by robust and relevant research evidence, that it's based on insights from meaningful statistics and also from local voices, the people who will be impacted. Ideally co-produced, although that's not always possible, and that it's properly evaluated. And then this would help us to make sure that we've taken into account all these likely impacts and on the most disadvantaged as well as more generally. And this is both in terms of whether people have appropriate access and also potentially any negative impacts. And I'll give one more example, which is that since at local level, we only have control over certain parts of the transport system, we have to be able to find ways to influence and those people, bodies that control the rest, because that's where we get the benefit of saying, well, we've diverted traffic to a main road, maybe from a low traffic neighbourhood, but we don't control that road. Well, what do we need to do to be able to improve things on that road? So this is where transport campaigns meet public health advocacy. And by working together, hopefully we can have more influence than either of us alone and change the whole system, and not just in our boroughs, not just in London, but across the whole country. Thank you.
Thank you so much for those reflections, and some of the stuff that we grapple with really constantly. And I'm particularly interested in the idea of local voices being heard, and we know that there are some boroughs which are working really hard to bring the voices to the fore, the voices that we don't ever hear really, because there are voices which we hear a lot of, and there are those that we don't hear at all. And so I think there's a lot to unpack there, isn't there? And that's a really useful steer, and really interesting to hear about the thoughts about joint evidence base as well. So thank you so much for that. And perhaps you can, I know that you'll be able to stay, Sandra, so that if people have questions towards the end, we can ask them then. So now we're going to move on to the results of this year's scorecard. So to present this year's results, we have Simon Monk from the London Cycling Campaign. So Simon, are you ready? Great. Okay, here we go.
Hi everyone. Hopefully you can see the slide. Yeah, it looks like everyone's brilliant. I'll get a thumbs up there, so that's great. So thank you very much for joining us. I'm going to rattle through the results this year as quickly as I can, and then we'll move on. But I think the thing that I wanted to say initially was very much, as Alice said at the start, this is a coalition of organisations that has worked together, and each year we kind of develop the scorecard to be more and more. There we go. More and more kind of complicated, advanced, data-led, nuanced, etc. And there's been significant change each year, in terms of the data sets we use, the mapping. Alice slightly stole my thunder because I really wanted to big up this year the work that's been done on controlled parking zones and the mapping of that. As we've gone along, we've realised over time that we have had to map much more kind of coherently a whole bunch of data sets around London that individual boroughs produce, but no centralised organisation produces, and there's not a kind of common data form, etc. So let's rattle through these, and we'll get to the mapping when we get to. So what as ever with the scorecard as it's developed, we break our scores into inputs, indicators, and outcome indicators. And very simply, inputs are the kind of things that boroughs have the power to do and do on an annual basis. They can actually make a shift in their scores and in what they do within 1 year. And so these are the short-term deliveries of scheme types that kind of go on year in, year out by boroughs. And the outcomes then are the longer term, and there is a noticeable lag between, people putting in inputs and then the outcomes that we see coming later. But so if you look at the input indicators, you can see we now have the bus priority measures as a part of the score. We did the bus measures last year, bus priority measures last year. We're really excited about the work that went into that, looking at bus lanes, bus gates, things like that. But this last year we kind of did it as a kind of an idea. This year it's actually passed the score. So the other input indicators: 20 miles an hour, control parking zones, low traffic neighbourhoods, cycle tracks, school streets, and STARS programme combined. And outcome indicators: sustainable mode share, active travel, regular active travel, KSIs or serious collisions and fatal collisions, and car ownership and the most polluting vehicle proportion of that. So I guess the big news, and hilariously on my screen, I don't know about anyone else's screen, but I've got all of your heads straight over the most important bit of the indicator. So the top scores, as you can see, City of London. Now we generally leave the City of London, as it were, aside somewhat, because part of the reason why City of London scores so well is because it's delivering tons of fantastic stuff, but part is because it has no residents hardly at all. So it's a bit of an outlier in terms of density and things like that. But the big scores: Islington, Hackney and Camden, with Islington really kind of cementing its lead. And then, and I have to rep this slightly because it's my home team, it's where I live, infamously or famously, is the top scoring outer London borough is Waltham Forest once more, and now noticeably outscoring both Lewisham and Kensington Chelsea on inner London boroughs. And then let's pause for a second and look at the bottom of the table: Hillingdon, Bexley and Havering. And I think, it's really marked. Possible did a piece of work about electric vehicle rollout and ULEZ opposition. It's really marked that some of the boroughs that we see consistently at the bottom of this scorecard are the boroughs that are taking ULEZ to High Court at the moment, that are also doing the least to actively change the situation. And I think that's really, really important. These boroughs have a choice, particularly on those input indicators. There's an awful lot these boroughs could do. Most of them, nearly all of them, nearly every London borough has declared a climate emergency. Most London boroughs are talking about air pollution and air quality, whether they support ULEZ or not. So there is a real thing here where the words are not matching up to the deeds, unlike the top kind of boroughs. Now, last year we did this and we looked at the overall result versus expected result given housing density. And when we look at density, we look at residential density. So we exclude things like huge parks, which I think makes Richmond upon Thames quite interesting, to say the least. So these are the scores. On the left here, you can see for boroughs, whether they're performing better or worse than their expected score based on their housing density. And what we found was there were several indicators that or several other metrics that correlated very highly with overall score, housing density being one of them, PTAL or public transport accessibility being another one. So essentially, the more, we recognise that the more there is an inherent advantage for inner London boroughs in terms of the sheer density of public transport, therefore, and the affluence of residents in some cases, therefore the likelihood that folks don't need to use a car in the way that outer London boroughs, many people still need a car because they are far from any public transport, etc. So there is a real noticeable inherent bias, but if you try and strip out that bias, which is really what this chart is all about, you see that boroughs like Waltham Forest, Richmond on Thames, as I said, Merton, surprisingly, are doing far better than expected. But look at the bottom of that score list. Kensington and Chelsea, and I'm just going to take a moment to highlight this, should be able to, incredibly dense public transport networks, affluent residents who should not need to own a car and have plenty of other options, and dense network of other forms of transport available to these people, yet look at that score versus density. This is the worst performing versus expected borough in the whole of London. Then we have Bexley, Redbridge and Hillingdon, again bumping on the bottom. So as I said earlier, we're really, really proud of the data sets we use. We try very, very hard, I think, as the Scorecard Coalition every year to improve the data sets, to look anew at what data we can bring to the table that will really reveal what London boroughs are doing, how they're doing it, where they're doing it. And we've recognised over time that we've really had to develop, as I said, our own data sets. This year, we've started from scratch with controlled parking zones. And so what you're looking at is a map of where CPZs are across London. And as you can see, that's a really granular data set that we've spent the whole year working on. And every year we'll finish this webinar, we'll go away, and almost immediately we'll start the conversation about what's next. But this has taken a year in planning and progress, and involved a volunteer who I think has done an amazing job here. But what's really interesting about this data set to me is you can see that pretty much most of inner London is now totally covered in CPZs. But even in inner London, there are notable gaps where we're seeing boroughs where there are underground stations, train stations, bus stations with virtually no CPZ around them, and that's truly incredible to me personally. Is we cannot begin to trigger mode shift, and we cannot begin to really get on top of car dominance if we have the ability for huge quantities of people from Surrey, Essex, Kent, etc., to drive into bits of even inner London, park up, and then commute cheaper. That just simply shouldn't be happening. And 20 mile an hour and CPZ rollout is absolutely it's the low-hanging fruit for boroughs. So if you can't manage to do that, really something is going terribly wrong. So we'd like to see this map massively expand further into outer London, and all of inner London certainly be covered fully in CPZs by the time next year rolls around. So that's my plea for this year. Okay, rattling through the indicators. Again, this seems to be my chart seems to be over there. But what you can see is there is a huge gulf opening up now between boroughs that are taking action, and boroughs that aren't. Low traffic neighbourhoods. Hackney has 70% coverage of residential streets, low traffic neighbourhoods. Bexley has 5%. So come on, Bexley. And you can see again, these are things that are, these are scheme types that can be delivered very rapidly. If you look at the shift for some boroughs in the last few years, between 2020 and 2023, it is dramatic. So these are scheme types, as with 20 miles an hour, as with CPZs, etc., that can be rolled out very rapidly and fairly cheaply. Okay, protected cycle tracks, obviously very close to my heart for LCC, but again, you can see the huge gulf opening up between Kensington, Chelsea at 0.3%, and multiple outer London boroughs less than 2%, and then look at Waltham Forest with 13%, Hackney, etc. So there are really huge gulfs opening up between those boroughs delivering on these types of schemes and those boroughs not doing so. So yeah, again, City of London way out in front on protected cycle track as a percentage of total borough roads, perhaps unsurprisingly, but it's Waltham Forest and Enfield, and then Hounslow next up, really. And two of those three boroughs were boroughs that had mini Holland funding that enabled them to get a jump on this one. But fascinating to see Hounslow and Camden coming in behind them. Okay, 20 miles an hour speed limits. Again, we're now seeing most of inner London pretty much doing 20 mile an hour as default, but where's Barnet and where's Bromley, both hovering at 5% of their roads at 20 miles an hour. 20 miles an hour, as we know, should be the urban speed limit. The default, because it saves lives, because it cuts road, traffic, because it does a whole bunch of useful things. It doesn't impact journey times massively, etc. So why are we not seeing these boroughs roll them out? Controlled parking zones from this new map. As you can see, we have nigh on 100% coverage in big swathes of inner London, but not all of it. Bromley, only 10% of the residential roads that should have a CPZ have a CPZ. And again, that granular map really is delivering on that. Okay, school streets. We are now up to 20% of schools from 2% in 2020. This is a huge success story. And I think, we have an ongoing conversation within the coalition. I hope it's not too revealing to say this, about whether STARS program now is actually a really useful measure, because school streets is such an obvious thing to do in London. Why are we allowing people to drive straight up the school gates and idle right there and things like that? We shouldn't be doing that. There should be far more school streets. And again, this is a program and scheme type that can be rolled out massively quickly. Huge kudos to Islington, like raspberries to Bexley. Hammersmith and Fulham say that they are going to get back on their school street program. We wait with bated breath. Okay, so that's hopefully school streets covered. Let's rattle through these very quickly. STARS programs. So as I said, there is an ongoing discussion about whether these things are truly valuable, because as you can see, Bromley is really hitting its stride in the STARS, but isn't doing much of anything else at all. So there is an ongoing discussion, but well done, Bromley, at least for that. We'll give you the kudos for the STARS program, and Waltham Forest, obviously, and Havering. So again, there is quite a gulf between those boroughs and all the other stats. Okay, bus priority. Again, we've done our own mapping on this. If I remember right, this is Sustrans, but huge kudos to the bus program folks who did this. But you can see that this is a mix of bus lanes and bus gates and bus routes through low traffic neighbourhoods. And so we can see, again, places like Hackney, City of London, Islington, Lambeth, where, you know, a significant proportion, you know, for City of London, majority, for everyone else just under half, are actually providing bus priority. And we know bus journey times are so related to bus ridership numbers, and we know how important the bus and public transport is in enabling people not to use their car and enabling everyone to get around. So I think, you know, we're really proud of this map. Again, look at the difference between inner London and outer London, but see that even within outer London, what you can see is a vast difference between places like Ealing, Merton, that have done quite a significant amount of bus lane work, bus, you know, gate work over history, and then boroughs like Bromley, again, Redbridge, Barnet, Bexley, and Sutton, and Bexley, sorry, where there's less than 1% of routes. Right, rattling through the outcomes, car ownership. You can see we're still looking at Camden, Islington, Southwark, places like that, having some of the lowest car ownership levels. And yeah, the note here is just to say, and I think we're nearly at the end of this, but the note here is to say that there were several bits of data that we could not roll over because there is not reliable data for 2022 yet because of the pandemic. So we're still seeing recovering changes, and we're still seeing some data sets not even being collected. That hopefully is a rattle through at high speed, and I'm bang on time. So a rattle through of all of the data. Huge kudos to the boroughs that are doing massively well and expanding their schemes and delivering despite funding issues, despite all of the political pushback. And yeah, like, come on, do better to the boroughs bumping along at the bottom of the table, particularly those ones who've declared climate emergencies, who keep saying that they're very keen on active and healthy travel and reducing pollution, but then keep saying, but we're not going to do anything about it. Because really, I hope, and that's one of the things that I certainly hope from the scorecard, that's the most key thing here, is that actually all of the scores reinforce the fact that there are things that can be done, even if you're Bromley, even if you're Bexley. You know, 20-mile-an-hour rollout, CPZs that start getting people to question their car ownership and start getting to people think about their car use. School streets, you know, LTNs, all of these things, there is funding available for them. They can be rolled out quickly. They can be rolled out cheaply. They can be done, you know, simply. Then there are junctions, you know, bus lanes, cycle tracks, etc., on main roads, as Sandra was talking about earlier, that we need to consider really, really clearly and get funding for as well. But like, all this stuff is doable. I think that's where I'll leave it. Thank you very much for listening.
Thank you so much, Simon, and for getting what was a huge amount of information into a very short period of time. I know that that we, you know, we try very hard to get it all into something quite tight, but it's there's a huge amount of information there. So please go and explore the website, which has now got all the new results on it, and do contact us, of course, if you want to ask any more questions about any of that. So we're really delighted to have with us today both Rowena Champion and Clyde Loke. So I just want to invite Rowena now, first of all, to say a couple of words. So Rowena, I presented a certificate to Rowena last week as they have won this year top in the London Borough on the Healthy Streets Scorecard, and it's the third year in a row. So congratulations to Islington. And yeah, Rowena.
Just wanted to say thank you very much to everybody who's involved in putting together the scorecard. I know it's huge amounts of work, and it's very much appreciated. It means an awful lot to us, and I'm sure to all my colleagues across the council as well, both councillors and the officers, and particularly the team that actually works on this, because there's huge dedication and resilience has to go into this kind of work. But it also gives us a really extra impetus for us to continue with our work, to work with local, work here at the council, but also across the boroughs, because we know that we have to do that in order to really transform the way that Londoners move around. But we know, because we've heard Sandra's talked about it, but our public health team as well work with us very closely on what we're doing, and they are very clear that the measures that we're putting in to enable more people to walk, cycle, wheel is really important to the public health agenda going forward, and to the well-being of local people. But just I suppose just one thing I did want to say, that we are in a circumstance where we are facing some real emergencies, so public health emergency through inactivity, obesity, but also climate change, biodiversity crises as well. And kind of almost the lucky thing is that we know, by enabling more people to walk, cycle, to use cars less, and then to use the space that we create to transform our streets into sort of greener, safer and healthier places, we can tackle all 4 of those in one go. So part of what we're doing, I think we see, is a little bit like a bit of a magic bullet. It's not easy, and we do need to, as Sandra says, make sure that we take into account some of the consequences that come out of this, and make sure that we have fairness and inequality at the heart of everything we do. But I just wanted to finish by saying thank you ever so much. We're really, really proud of being the top in the London Borough, and we do know that we have to continue to roll out more of these to enable us to remain there for next year. Thank you.
Well, thank you very much, Rowena, and I'm sure that the coalition and the hard work everybody puts into this will appreciate hearing that. And it's just incredibly important to us that there are boroughs out there that are delivering and showing that it can be done. And I think my own history is working at the local government association for many years. We tried very hard to demonstrate that some boroughs, can very can do and will be out there delivering and showing the other boroughs that it is possible and that we can get there. So yeah, I just wanted to invite Clyde Lokes now, Councillor Clyde Lokes from Waltham Forest. If you're there, Clyde, I can see you're not. Say a couple of words. Yes, here we go. So Clyde Lokes from Waltham Forest, which one best Outer London Borough this year?
You can't. You need to enable my video.
Oh,
Sorry.
I don't know how to do that.
Might be able to work now.
Oh, there we are.
Yes. Thank you. Well, basically all that Rowena just said, and some more. Obviously, it's great to have this accolade, and I really appreciate all the people that kind of scrutinise and pour all over our data to come up with these kind of maps and stats and such like. However, it actually means nothing unless other boroughs kind of pick up the baton and cycle or run or walk with it, and take us out. Basically, I don't want to be the top Outer London Borough forever, like another couple of years maybe, but I don't want to be in that place forever. I'd like to see Redbridge, Havering, Barking and Dagenham, basically take us out, because that means the stuff that we've pioneered in Waltham Forest and in Islington and in Hackney, Camden, etc., is starting to kind of filter through and become the norm. This has always been for Waltham Forest about normalising this activity, not making it kind of unique or rare. And I still think we have some way to go in that kind of normalising agenda. But, when we started out on our journey 10 years ago with our Mini Holland money, it was about walking and cycling. Now it is so much more about air quality, public health, the climate emergency, the biodiversity emergency, and all bringing all of these things together now. And this is a great opportunity to do this and showcase it, because who does not want to live in some of the streets that we are creating as a consequence of introducing low traffic neighbourhoods, and the opportunities of reducing parking for cars brings to those streets with regard to flood resilience, for example. And we saw some of that, Alice, last week when you visited us. The one other thing I would say, a plea, and you're not going to be surprised, I do think complementary measures needs to be measured in your scorecard. I think people that are investing in putting in cycle hangers, cycle training, doctor bikes and stuff like that needs to be recognised in this space as well, because it unlocks that potential. You know, people aren't going to cycle unless they've got somewhere to store their bike safely. And in London, you know, a really dense city, you know, where lots of people are living in kind of flatted accommodation, then that is critical to kind of unlocking that potential even further. So please, my plea to you is next year, let's try and get some metrics in that place as well. The other thing I think would just be useful, would be good to know what the cutoff dates for your data is, because I'm pretty sure I've introduced a few more CPZs that would have taken us over Ealing in that particular column in Chingford. So yeah, so it would be good to kind of know what the cutoff dates are, just to make sure you are fully aware of all this fantastic stuff that we're doing. But I reiterate that point again, I don't want to be top forever. I want others to be top, because that to me proves that it's working and we're delivering for London. Thank you.
Well, that's a quote for the year there, Clyde. Well, I don't want to be top forever. I think I might write a song with that in it or something. Yeah, so metrics, I mean, absolutely, we would so love to have so many metrics in here, and putting together the ones that we have been a huge job, and how we would go about that is just something something we need to reflect on. It's not easy, and I say we are often asked about not just active travel infrastructure, but green infrastructure, and how we might reflect that in the scorecard. It's extremely it's complex to do. It doesn't mean we don't want it in there, I think is kind of what I'd say about that. So moving on to Phil Glanville. So Phil, you have the unenviable job of having to speak on behalf of all London boroughs, and I know that we have a councillor from Bexley here today, and I know we've given Bexley a bit of a hard time, and all boroughs are very different. So I know that it's never easy for you to represent everyone, and indeed you can't really, but please, if you can, help us to see from the perspective of everybody how things have gone this year, and how we're going to get on with delivering into the future. And thanks so much for joining us again this year, Phil.
Thanks a lot, Alice, I think, and the coalition, Simon, for that amazing canter through, and everyone on the call. I'm obviously going to thank Sandra for introducing the links between public health at the start of the meeting and what we're doing around active travel and climate. I think it was really powerful, and I think there's much more we can do on that agenda. As you said, I represent all of London councils on a cross-party basis at this event, but I can never quite take my Hackney Mayor hat off. So in what I say, I'm going to jump around a bit between those two hats. I also just want to recognise the work of public health leaders, not just Sandra, but all across London, around the work on active and sustainable transport, and how the NHS more broadly as well, beyond local government, have sort of come together around this agenda over the last couple of years. You know, the letters that they sent to leaders like me and active travel cabinet leads like Clyde Marina were really powerful during the pandemic, and I think really set that idea of the type of city that we wanted to be, and they continue to show that leadership on air quality now. Huge thank you as well to tech colleagues. I'm going to speak about some of them as I go through, but being chair of the Transport and Environment Committee for London Councils is literally the best job anyone can do in London's local government, and that's no offence to other spokespeople, but you have this incredible network of people that are really connected to their own places. So there's the collective effort and the individual effort. For me, this awards is a bit like the Oscars. It's that key moment in our civic calendar. I've said it before. It can be really fun, but underpinning that, I think, are the stats that, you know, the 2 in 5 adults and 2 in 3 children in London that don't get enough physical activity. We know that physical inactivity costs the NHS over £1 billion a year. That doesn't include the impact of ill health from air pollution. And we know that in the last full year of statistics, 2022, 48 pedestrians and cyclists were killed on London's roads, and 2,200 were seriously injured. That is very sobering, even though we've all signed up to a renewed Vision Zero. And I don't want to forget motorcyclists and couriers in those statistics as well, because they're some of London's most vulnerable road users. We also know that transport in London is responsible for a large share of our carbon footprint. London Council's recently published analysis showing that transport is London's biggest source of emissions after housing. Then it comes waste and our food system, but transport is still absolutely critical to getting to net zero, and we lead a thematic group of London boroughs around low carbon transport, as well as the work on active travel. Without action, continuous action on metrics measured in this scorecard, we aren't going to see the progress. I think, Clyde, Simon, others have spoken about it. We all should be committed to moving up through the scorecard. It's healthy competition. It's not the sort of competition for resources that can lead to a sort of reductive competition. I think it's really important. I wanted to go address three things quickly today. One is to firmly congratulate the winners and the challenge from the scorecard. Second is to consider what we've learned from the journey towards sustainable travel so far. Third is to look ahead and to see where we'll be next year for a crucial time, I think, for this individual and collective work and what it requires of us. So just to pick out some of the top scores in the 23 metrics, I'd be churlish not to say that we have been really successful in terms of Hackney, in terms of scoring on some of the key significant things. I pick out the bus lane and bus prioritisation work. But although we've led many of the categories, in all seriousness, congratulations to Arena and Clyde with Islington and Waltham Forest. They've rightly topped the charts overall. But I think nearly every borough has made some progress. We've also seen some of the thought leadership with their curbside strategy. And as has been referenced, although the City of London sits sometimes outside, actually that consistent action and leadership can't be taken for granted by any of us. And many of our active travel and public transport systems do feed into the City of London and the work that they are doing. I think Bromley's work on school stars deserves a shout out. Brent's high sustainable mode share, and Richmond and Wandsworth joining so many of us around 20-mile-an-hour speed limits. I think that is incredibly important. It's disappointing when you look even as a borough like Hackney, and I'm asking the questions already about the school stars and how we can do better on that. But I think anyone, if they want to be inspired, is just follow the roadmap on Healthy Streets, follow these categories, and you can make an incredible amount of difference. The second thing I want to talk about is the metrics and the detailed commentary. I think what it shows is that progress requires determination and prioritisation. I think it's not enough to just make some changes in 1 year and leave it at that. Councils need to be constantly monitoring and adjusting and consulting to see what works and going further. I'm really pleased that the scorecard adapts, around bus prioritisation and building new alliances. That's been incredibly important over the last couple of years. In Hackney, we know we've got that ambition around low traffic neighbourhoods and a record of delivery. We're going for 75% coverage, but we know we've stalled a little bit on school streets. We need to pick up that baton again. And I think it was in the chat earlier from Charlotte, there are still too many pedestrian collisions in Hackney despite all of our positive infrastructure. So that focus on junctions, those focus on crossings that I know are incredibly important is going to be part of our journey over the next 2 years, as well as expanding bus prioritisation and cycle and EV infrastructure. I think we have to be really clear that it isn't just a journey for planning and transport departments, communications, behaviour change, public health, as we've talked about, but also how we use things like traffic enforcement officers. We've just brought those back in-house in Hackney. That gives us greater flexibility. It also allows us to match that flexibility with the expansion of CPZs to almost all of the borough. It can never just be about one type of infrastructure. It's never just about cycle lanes or school streets. It's how they all connect up together, and that's how you get that collective impact that's seen in the scorecards. The 20-mile-an-hour speed work, I think, is incredibly important. I referenced some of the boroughs earlier, but we're starting to see all boroughs moving in that direction, I think, or at least thinking about it. And we've seen TfL significantly expand their network of 20-mile-an-hour streets. That is incredibly important because while the boroughs control 95% of our streets, that 5% is often where people are crossing. It's in our town centres. It's part of those key trunk routes. and they need to be not just supported around cycle lanes, but also those critical crossings between our LTMs and other types of infrastructure. Final topic is how we keep on building on this. I think civic society is inspired, boroughs are inspired, just seeing that collective political leadership. I've always said you can't do it without the support of citizens and coalitions like this. But we're going to be looking forward to a mayoral election next year and a general election. And I think anyone that is in this space that has led any improvements, and I would say school streets can be just as controversial as an LTN or a cycle lane. It takes real bravery and real leadership. And we know that it's getting harder and harder from the sort of abuse that people get online, seeing all of this work being treated as a sort of political football, not a political debate, but a football. Political debate is a good thing. Treating it as something that can be kicked about is not. And I think there's some fear that both major political parties may deprioritise the funding for this work if we don't continue to show its importance. We should be very proud in London. You know, there is a London versus the rest sometimes in the national political debate, but I think we can be really proud of what we've done, and we must be, because we are continuing to inspire other cities, towns and communities across the UK. And I think that is really, really important. We build those coalitions outside of London. We see what is happening in other cities and continuing to make the case to Active Travel England and others. We also need to continue to do the thought leadership. I mentioned the curbside strategy earlier, but in Hackney, we're still examining road price feasibility. We want to make sure that we don't rest on our laurels and we think about what further changes will be needed beyond the interventions that we're celebrating here today. We need to also continue to gather the evidence and monitor outcomes, as well as the metrics that are used here, and continue to engage with residents and businesses, because things like the zero emissions network, the work around a lot of bids in London are doing around supporting active travel. It isn't just enough to create the infrastructure. It is the cycle training, it's the advice to businesses, it's the support where people need to use and commute. And I think we need to continue to invest in this. I would say that the Healthy Streets Scorecard does show the way, but there's no single right way in individual communities. There'll be different solutions, and that's what local leadership is about. And I think, you know, the debate in the chat shows it's lively, but we can all make a real difference. So a huge thank you for inviting me again. I represent, I think, some of the most dynamic officer and political leaders and civic society anywhere in the country. It's a huge honour to be here, and I hope that as you release that data and presentations, the debate will continue and we'll see even more improvements next year. And I look forward to, even if I'm not speaking, being here at the awards in 2024 and recognising that progress in what is going to be an incredibly busy year. Thank you.
Thank you so much, Phil. So it's always incredibly great to hear from you. Just a couple of things I picked up there, and started me thinking about which of our indicators will be first to go London-wide, and I'm hoping that we might be there with 20 miles per hour in a couple of years. Which borough, maybe we'll get there with school streets. In certain boroughs we'll be at 100% maybe, and we might even be at 100% with low traffic neighbourhoods in some. Of course, we are at 100% in some boroughs with controlled parking already. So yeah, we've got a job to do as a scorecard to reach out to the boroughs, where, of course, you know, we know that it's difficult and it's different everywhere, but we are here to help and to offer, you know, whatever support we can, and we really do want to reach out to those boroughs which are, for whatever reasons, finding it harder to consider or to actually implement these measures. So that door is always open, and we really do reach out with you know, with a hand very willing to talk. So yeah, so we're now got a few minutes left for questions. It's 4 minutes to 11, so I'd hope to finish a bit earlier, but we will. I think if we have quite a few questions, then we're not doing raised hands for questions. Questions go in the chat. And then Jeremy's going to pick out a few, and we'll keep going perhaps till 5 or 10 past if we can, depending on how we go. Okay, so Jeremy, what have you got?
Great. Well, we've had some fantastic chat, as Phil mentioned just now. comments made and questions raised. So the first one was just a point of accessibility that Carolyn Axtell made earlier. Is it possible to have captions enabled for the meeting? And Charlotte said, yeah, that would be really helpful. And UDG have replied, who've run this, and it's fantastic the work they've done. We don't have it set up for this meeting, but it's something we might be able to do in the future. So thanks for raising that point. I think the next main issue is just some questions and some real appreciation for Dr. Husband's presentation, but just a couple of questions really. One from Mark Smithies, which is, firstly, what role should health and wellbeing boards play in promoting healthy streets, as healthy streets are central to improving health equity and outcomes? And Ollie Moore has just asked as well, would be great to hear from Sandra any suggestions on what further equity aspects or metrics can be added to the scorecard.
Thanks, Jeremy, and thanks for those questions. Just in terms of the Health and Wellbeing Board bit, I guess it depends on how you use or how you work with your Health and Wellbeing Board locally. We in Hackney and in the city separately, we have in separate Health and Wellbeing Boards, are using the Health and Wellbeing Boards to drive to be the sort of focus for the health in all policies work. So you get all the right people around the table to discuss all of those issues around wider determinants of health and how you need to and can focus on health and reducing health inequalities as outcomes of all of the different areas of work. And funnily enough, Healthy Streets is not one we've had on the agenda to date, but it will come at some point because we're looking at all the things, whether it's the built environment, education, the natural environment, etc. So I think that the opportunity to drive a Healthy Streets programme through your Health and Wellbeing Board by having all the right people there to understand and agree what needs to happen and to understand the impacts, whether you're starting with something like school streets, which may have less traffic impact across the borough, but equally controversial, as Meg Glanville was saying, then it's just an opportunity to have that focused discussion, but with all the partners who can help come to an agreement across the whole partnership and not just the whole council about why it's important and how you can drive it through. And then the other question about metrics, I can't think of a very specific metric because it really depends. But what would be useful is to perhaps we'll have a conversation about it and think about the kinds of ideally in each area you'd do a health impact assessment, health inequalities impact assessment. But if you're saying, well, what do we want to understand from the scorecard point of view, like to show the progress in terms of taking into account and reducing health inequalities at the same time as increasing active travel, there is possibly one or two summary metrics that might be useful, but I wouldn't be able to say off the top of my head across the whole of London, this is what it is, but definitely worth a conversation.
Brilliant. Thank you so much for that. That's fantastic, Sandra. So just a couple of points about a bit more technical ones, just about the value of the indicators. So John Chamberlain's written, good to see account being taken of the size of CPZs. Will you consider also looking at hours of control? Many CPZs only function for part of the day and people drive in and park outside those hours, especially in evenings and weekends. And then Katie Rodder's made a really nice point, which is similar. People need to ask the same question about timed bus lanes, which make non-rush hours cycle travel worse where there are no cycle lanes. So just a couple of points about, well, obviously substantively about those issues, but also about how the indicators might be able to take account of those.
Was that a question, statements or question there? So I think the statement that those are, that we take those as read. It's yeah, we constantly reflecting on how to take into account the qualitative aspects of control parking and bus lanes as well. So we just need to keep thinking about it. It's just very, very difficult to put that into a succinct score. So we do what we can to do it in the best way that we can.
Brilliant. Thanks, Alice. So a point raised by Councillor Richard Diamond, who's a Bexley councillor, and Richard says, as a Bexley councillor, I'm really fed up with people from inner London telling us what to do. I'm sure that some residents would support these measures, but you only have to look at our residents' real anger over ULEZ expansion to realise what the majority of residents want. And then I think the follow-up to that is a really nice question from Mia Jenkins. Question for Clyde Lokes. As an outer London borough, how do you bring your residents with you on some of these changes when car driving may be more of a default in that area?
I don't know if Clyde, you can help us with this one.
More than happy to help you with this one. I mean, Waltham Forest is an outer London borough. You know, we're treated no differently to other outer London boroughs. But, you know, we made a conscious political decision, recognising the public health challenges that our population face, recognising the air quality challenges we faced in our borough, recognising the climate and ecological emergency, recognising some of the economic challenges that some of our localities faced when they were dominated by, you know, a car free-for-all through them, that their actual economic survival depended on making these places better for people first and foremost, and that meant creating better places for people to walk and cycle and catch the bus to over the needs of the private motor car. So, you know, as an outer London borough, that's what we've done, and we have made a difference accordingly. And we have brought people along with us primarily because we have spent a lot of time engaging with them, a lot of time consulting with them, but also being prepared to provide political and community leadership on these issues, and not allowing the lowest common denominator schemes to dominate that deliver very, very little, if anything. You know, and that was the history of Waltham Forest before we got our mini Holland money. We'd consult on schemes that were set out to kind of improve mode share for bus use, walking, cycling, and actually delivered nothing other than allowing the car to dominate our street scene. So you've got to provide that political leadership. You've got to bring your community on board, and our community champions out there who are prepared to work with you and for you when you come forward with decent schemes. And the schemes have got to be decent schemes. You know, we cannot just create tokenistic schemes any longer. People expect good, solid schemes to come into place because they want them to last. And they want them to make a difference. And I think that should be one of the learnings from the period of the stuff that we were putting in across London during the COVID lockdown. And people want decent schemes. They don't want cheap and nasty that don't deliver that long-term benefit.
Thanks so much, Clyde, for helping to answer that. I'm just going to bring Phil in quickly because I know that Phil has to leave.
Yeah, I echo what Clyde said. There's something as well about, I think, how the infrastructure sort of joins up. There's a lot of kind of bike lanes to nowhere across Britain that don't connect up to other policy. And I've always said, when people say, how did Hackney do it? It's a 40-year journey that starts with things like controlled parking, car-free development, and it allows you to overlay each layer that's sort of represented by the scorecard, as well as being, you know, an inner London borough, but, you know, historically has had poor tube connectivity. Obviously that changed with the overground, but very dependent on the bus. You know, the biggest mode share is the bus in terms of our sort of focus, and we should never get into those sort of battles, I think, between, you know, busing and cycling and those sorts of things. Just a more general point about London, and I think it's as relevant for the ambition that Waltham Forest and Hackney and Islington have in inner London, but also Bexley and Bromley. You know, the funding settlement for London's transport system is inequitous. It puts us in a very parent-child relationship with the government. It historically means that the tube fare is subsidising everything else that we do, and it's unsustainable, and it doesn't allow long-term local decision-making. So one of the roles at London councils is trying to fight for a better funding settlement for boroughs and also TfL within the COVID period, but also going forward and thinking about what will become a spending review. We do need more funding going into those 95% of roads that we control. We will always have to conform to a mayor's transport strategy. I'm obviously very proud of the Mayor's transport strategy, but I recognise there will be challenge to that. But ultimately, these things that we all want to do, whether it is a safer junction, maintaining our roads better, or the ambition we're talking about today, is dependent on that funding settlement and getting a better deal for boroughs to continue this ambition. And that's something that my focus is definitely cross-party on. I'm meeting the Transport Minister in 2 weeks' time.
Great, thanks, Phil. So, Alice, are we still okay for a couple more questions?
I'm happy to carry on if I know that Phil might need to leave, so we'll say thanks so much. If others can stay, then we'll stay until 15:15 the latest. So yeah, let's carry on, Jeremy.
Okay, so a really nice big question, big picture question from William Buller. To what extent does Healthy Streets Action help councils to meet their net zero commitments?
Who could answer that one? Simon.
I mean, there is obviously a massively complicated link. You know, we for London Cycling Campaign, we did a Climate Safe Streets report recently where we tried to start looking at those kind of links, and it is really difficult to make a direct link. The London emissions leggy data, for instance, has changed methodology multiple times in the last few years. But what we do know and can simply say is Sadiq's modelling for London shows that we need to cut road kilometres driven 27% by 2030 to get towards net zero, as well as electrifying a significant proportion of the remaining motor vehicles, as it were. So we know we need to cut road kilometres driven. That is almost universally the case. You look at the England figures, Creds has a really good study on this and pathways to net zero for England. You look at internationally, other cities, everyone is saying you need to cut roads, driving basically. So we know that there is that. We also know that the scorecard metrics we look at do, you know, reduce road kilometres driven, do reduce car use. There are now increasingly an academic body showing that things that we're talking about generally, whether it's low traffic neighbourhoods, protected cycle tracks, CPZs, etc., reduce car ownership, car use, etc., and car kilometres driven. There's again possible doing great work in this field. Have just done a study about that with the University of Westminster on LTNs, for instance, and driving kilometres done by residents in LTNs. So we know there is a strong link between all of the metrics, and again, you know, one of the things we do over and over again is we assess these metrics very carefully year in, year out, see what we can expand. There's been several suggested metrics added, you know, to be added, and we've looked at, I think, at all of those, and trying to get the metrics is much harder than it might first see. So I hopefully that indicates that there is a clear correlation between all these things and reducing emissions. It's the link that I think just about every policymaker in this field makes, but trying to make a direct link, you know, if we tried to introduce a metric now on emissions or something like that, it's much tougher than you might think to make that link absolutely directly. But there is a very strong and clear kind of pathway correlation here.
Lovely. Thank you, Simon. So I just want to go back to the first question asked, which was from Charlotte. I noticed that Hackney had surprisingly high pedestrian casualties, and just wondered why that was such an outlier when Hackney scores so well in other areas. And I just wanted to say, I think, you know, Phil Glanville touched on this when he said that there was a real focus in Hackney on junctions and crossings, but it is, and I think we do have a slight problem with the metric that it's a rate-based one, and we are sort of low on data from TfL about numbers of journeys that are walked and cycled over the last couple of years from the pandemic. So there is a slight question about that, but the point is well made. But I think it's really interesting that Redbridge, Barking and Dagenham and Hackney are all significantly higher as East London boroughs in relation to pedestrian casualty rates. And I do, you know, I mean, other people will know this better than me who live there, but I think there are issues around the amount of through traffic in that borough, in those boroughs, and potentially the speed of that traffic. So I think it's a really, really good point to raise. It's something we would like to get to the bottom of in more detail, but I think there are some issues that, you know, are really worth looking at in a bit more detail there, but thanks for raising that.
Sandra, I think, was going to come in on that.
Yeah, just wanted to add
Yeah.
to what Jeremy said. I think that is I'm glad you picked up on it. I think there isn't an answer. It's not as though we know why people are having accidents and we're doing nothing about it. So we don't know, but there is also multifactorial. So it's not just a question of cars travelling at speed. It's also a question of whether there's enough space on the pavement. And there are definitely certain areas in Hackney and in the city, actually, where the pavements are relatively narrow. And also there are quite often obstructions and people walk into the street, which is understandable. I've done it myself. But the point is that we've created and designed the modern city to prioritise the road traffic and assumed that pedestrians can get down any space and forget that people actually not only are in a hurry, but that some of them really need more space. You know, they're pushing a buggy or they're in a wheelchair. So there's quite a lot of work to do that's not about the traffic itself, but that enables the reductions in accidents as well as encourages people to walk and use the pavements. That still needs to be tackled. And I just wanted to raise that because I just do think that thing about we forget about the pavement and we really shouldn't is really important.
Thanks, Sandra. No, and I think that's my mantra, which is hashtag not on the pavement, please, which I post quite a lot, is a really good place to kind of try to wrap up. So Jeremy, if there were any more statements, perhaps rather than questions, we've got about a minute or two, and then I can wrap up.
Okay, so yes, a lot of statements. So a really nice one from Caroline Woodley on joining up evidence, best practice and campaigning. I'd love to see a focus on how we're supporting independent travel for children and adults with additional needs, neurodivergent and disabled people, bearing in mind the social model of disability. And Susie Morrow, regarding low traffic neighbourhoods, is anyone evaluating the impacts on residents of other areas who may directly benefit from them? In Wandsworth, while they were in place, the low traffic neighbourhoods provided a safe cycling environment for sections of some journeys that I needed to make, even though I lived a couple of miles from them. Yeah, so I think that's probably, oh, sorry, and just lastly, I just wanted to pick up on Ed Davies' points. I think Ed's left now, but he made some really lovely points at the start. I designed and delivered Thrive London mental health training to 530 counsellors in all 32 London boroughs and the city. I used the Healthy Streets Scorecard in every session to encourage counsellors to take more action. So thanks for this resource, and I will use the new scorecard when I train London Assembly members tomorrow. So fantastic way to round it off with that seal of approval.
Thanks so much. And yeah, not to forget the mental health side of everything, which when I remember somebody describing to me the constant sense of harassment they felt and were never able to open their window. So that's it for today, folks. And thank you so much to everybody who's contributed, particularly to Dr. Sandra Husbands, who's taken the time to come and speak with us today. That's been an incredible contribution, invaluable, really. And I really hope we can build on that from this point forwards. So yeah, that really just remains for me to say thanks to everybody else for joining and taking the time to listen, and to all the councillors out there who are grappling with this agenda and delivering on the ground, and to our coalition who have stuck with it for the 5 years and who have put so much effort into making this happen. So thank you everybody, and goodbye.